U.S. President-elect Donald Trump has said he is open to leaving intact key parts of President Barack Obama's health care bill. Mr. Trump, who has pledged to repeal the 2010 law, said he will keep the ban on insurers denying coverage for pre-existing conditions. He told the Wall Street Journal that he also favored allowing young adults to be insured on their parents' policies. "I like those very much," Mr. Trump said of the two pillars of the bill. It was his meeting with Mr. Obama on Thursday that had made him reconsider his calls for an all-out replacement of the Affordable Care Act, he told the newspaper. Asked whether he would implement a campaign promise to appoint a special prosecutor to investigate his defeated Democratic opponent Hillary Clinton over her use of a private email server while Secretary of State, Mr. Trump said, "It's not something I've given a lot of thought, because I want to solve healthcare, jobs, border control, tax reform." Meanwhile, protesters angered by Mr. Trump's election gathered in several U.S. cities for a third night on Friday. Thousands took to the streets of Miami, Atlanta, Philadelphia, New York, San Francisco, and Portland, Oregon, voicing anger at the president-elect's comments about immigrants, Muslims, and women. Police in Portland are investigating the shooting and wounding of a protester on a bridge where anti-Trump demonstrators were marching. Officers had earlier used stun grenades to disperse a crowd of hundreds of people in the city center. In a separate interview with CBS, Mr. Trump said the parts of Mr. Obama's health care bill he was going to try to keep were the strongest assets. He said that while the bill would be repealed and replaced, the changes would provide Americans with great health care for much less money. He made the statement during an interview with the 60 Minutes program, which is due to air on Sunday. Also on Friday, Mr. Trump put Vice President-elect Mike Pence in charge of his transition team, replacing New Jersey Governor Chris Christie. Complicating the matter is that a revise and reform effort may not fly with Mr. Trump's ardent supporters and the cadre of arch-conservative politicians in Congress, who want to tear up the law root and branch. Mr. Trump often broke with Republican orthodoxy while campaigning and didn't pay a political price. He may learn that as president he won't get far without his party establishment's help. During the election campaign, Mr. Trump said the government-run health insurance marketplace was a total disaster and a catastrophe. "Obamacare is just blowing up," he said only last month, while promising his own plan would deliver great health care at a fraction of the cost. While running for president, Mr. Trump did not offer much detail on what he envisaged would be Obamacare's replacement. The Republicans' plan included tax-deductible health savings accounts and allowing insurers to sell coverage across state lines. His apparent change of heart on Friday comes amid a surge in applications to join the plan from Americans possibly fearful it is about to be overturned. More than 100,000 applicants snapped up Obamacare health insurance on the day after Tuesday's election, this year's biggest sign-up, the Obama administration announced. About 22 million Americans would be without insurance if the law was repealed. Congressional Republicans have voted more than 50 times to undo the law. Though the Republicans have maintained control of the Senate, they cannot repeal the Affordable Care Act in its entirety because under Senate rules, the Democratic minority remain in a position to block the move. The Republicans could, however, starve parts of the bill of funding through a budgetary process called reconciliation. The law has not been without its difficulties. Last month, the Obama administration said the average cost of medical coverage under the bill was expected to rise by 25% next year for those Americans who do not qualify for subsidies. And about 1 in 5 consumers would only be able to pick plans from a single insurer, it added. Former President Bill Clinton last month called the unsubsidized portion of the law the craziest thing in the world. In the U.S., unlike in many other Western countries, private companies, rather than the government, provide health insurance for most citizens.